Well, I'm going to start with an introduction to spinal muscular atrophy. And this is perhaps the face of spinal muscular atrophy. I've shown here 3 patients with spinal muscular atrophy. We group them into different types. This is more of a historical type of categorization, but type 1 being the most severe infantile spinal muscular atrophy. Type 2 and type 3 are the later onset spinal muscular atrophy. And we group them into patients who sit but do not stand or walk, as well as the patients who are able to walk, the type 3 patients. And you see this broad spectrum of severity from an infant who cannot even really breathe on his own to an adult here. She's actually 43 years old in this picture, and she's able to stand and walk. And you might even ask the question, how is it that we can even categorize these as all the same disease? And in fact, at one point, we would have categorized these patients into different categories and called them different diseases. But the reason why we now categorize them all as spinal muscular atrophy is because they all have the same underlying cause of the disease. So spinal muscular atrophy associated with mutations on chromosome 5q is an autosomal recessive disease caused by mutations in the SMN1 gene. And this leads to a progressive degeneration of motor neurons. And this is what this cartoon over here on the right is trying to show, is that the anterior horn motor neurons are projecting out to the muscles. And these are the neurons which control the muscles. And these are the neurons that progressively degenerate in spinal muscular atrophy.